In this video, we're going to discuss the supraspinatus rotator cuff muscle. How can you test for it at home? And then what are some things you can do at home to improve your range of motion, pain, and strength? The supraspinatus muscle is one of the four rotator cuff muscles. It travels from under this area, under the trap muscle, goes over to the outside of your shoulder and attaches. This is going to be a right shoulder, so you're going to look at this. This is looking, the person would be looking away from you, and you see the supraspinatus. This is it right here. It runs under this arch, comes under this bone area here, and then attaches on the outside what's known as a humeral head. And this does assist with bringing your arm out to the side, as well as stabilizing the humeral head or the glenohumeral joint. That's the joint where the shoulder, it kind of is formed. That's the upper arm bone meeting the scapula of the shoulder blade. And so it's very important, and a lot of times this one can be irritated, aggravated, and it can take some time to get better. In some cases, it just keeps going on and really doesn't want to get better. The first thing I want to do is go over the symptoms. Where are you hurting? What are your symptoms? And then check this muscle and its corresponding tendon to see, in fact, if this is what's going on. Now, you're going to have pain a lot of times across the upper trap area right here. It's going to hurt on the outside of the shoulder. It's not uncommon for that to radiate down. Some patients report that their elbow hurts, or even down the forearm, what's known as the proximal forearm area can hurt. Can radiate up to the side of the neck. That can cause pain as well. A lot of people have pain when trying to reach forwards, like they're trying to reach out and grab something, or when they try to bring their arm in the front or out to the side. You may have a reproduction of those pain symptoms. And so there's really three tests I like to go with. Now, these are not all inclusive. There are a lot of tests you can do for the shoulder. You know, we want to rule out the neck and all these other things, but just speaking specific, we think it's probably the supraspinatus. So let's run through three tests and see if these what they show up. The first test is called a drop arm test. And what that's going to be, if you have someone that can help you, they're going to bring your arm out to the side, and then they're going to let go, and you're going to see if you can hold your arm in that position, or if it kind of drops. Maybe you bring your shoulder up like this and kind of shrug up to try to hold it. If you don't have someone that can do that, you can take a piece of PVC pipe or a cane, use your other arm, kind of push it up there, and basically you can still hold onto the pipe and just try to hold it there. See if you can hold it. If you can't and it comes back down, that's going to be a positive drop arm test, and there's a high probability that at least you have a partial thickness or a minimal tear going on in that tendon. Our next test is going to be the full can test. What you're going to do with this test, you're going to bring your arm out, not straight in the front. I like to do it about maybe 30 to 40 degrees here. You can pull it more out to the side. That's just your preference. But I'm going to go out here, and what I'm going to do is I'm going to take my other hand and push down. So I'm pushing down, and I'm going to resist my other hand pushing down. So I'm trying to bring my arm up towards the ceiling. I'm resisting. Does that reproduce my symptoms in that exact location or cause that radiating symptom down the arm? If so, then the test will be positive. If you have someone that can do that for you, it's a little better because you can just focus on holding the arm there. But if they push down, or if you push down and you get reproduction of those symptoms, then the test is positive. We're going to move on now to the empty can test. This test is going to be the most aggressive of the three tests. You're going to back in that same position out to the side. You're going to rotate so that your palm is facing away, your thumb is pointing down. Now, you're going to push down with that other hand again. You're trying to resist that. If you have someone again that can do this, that works better. And you're going to see if that reproduces your symptoms in those same locations. If so, then the empty can test is in fact positive. So if you go through these tests and 2 or 3 of them are positive, then there's a high probability that you probably do have some involvement of the supraspinatus rotator cuff muscle and its corresponding tendon. Our first thing we're going to do is work on range of motion. You know, this is one of my favorite exercises for patients. If you watch my videos, a tabletop slide using a pillowcase or a towel. I like this versus climbing up the wall. I'm not saying that's a bad idea, or even taking the pillowcase or a towel and sliding up the wall. This is just a little bit less invasive, gives you a little more control of your shoulders. So especially if it's really painful, you don't have to worry about really aggravating it. So what you're going to do is you're going to put your affected side down. So your affected shoulder, or your painful shoulder, that hand's going to go down first. The other hand goes on top. And what you're going to do on top of a table or a countertop is just kind of slide back and forth. I'm using my left hand to do most of the work. I'm going as far as I can. If that's too painful and I'm not able to slide that out, what I'm going to do is find a spot, even if it's right here in the middle of the table or right on the edge, and then I'm just going to back away. And as I back away, I lean away. That is performing range of motion on my shoulder, a little stretch there. So if I stood up, you can see how high my hand would be just by leaning back. I really like that. And that's something I typically have patients perform for maybe 10 to 20 repetitions, multiple sets just throughout the day. That's okay as well if you have some pain with that. Expect pain with this. This is a painful condition. And so if you're trying to increase that range of motion and your muscle strength, just be aware you're going to have some pain increases. Now we're going to progress to a standing cane, or you can use a walking cane, broom handle, PVC pipe, a standing cane, shoulder elevation exercise. What you're going to do with this is I'm going to use my unaffected side, so my left hand is my unaffected side, to bring my right hand up as high as I can, and I'm going to come back down. Probably what that's going to look like for you, especially if this is really painful, is something more like this. That affected side is not going to want to come up as high, and that's fine. It's also normal for you to have a shrug sign. So when you come up, your shoulder to kind of shrug up a little bit, that's okay. Over time, as you build strength, the goal is to kind of try to get rid of that, or by doing these other exercises and movements, try to get rid of that kind of compensation that goes on. So just going to raise that up all the way and then back down. Repeat that for 2 to 3 sets of about 10 repetitions, and that again is something you can just perform throughout the day. Taking the same cane or broom handle, we're going to go out to the side now, what's called abduction. So I'm just going to grab the end of the cane, and I'm using my left hand to do most of the work. I'm helping with my right shoulder with this. However, I'm letting my left hand do most of the work. Eventually you want to get to where you're doing all the work yourself, so eventually you don't even need the cane, and you can just work on bringing your arm out to the side, and then you can progress to bands, dumbbells, weights, all those types of things. But this, just like the previous exercise, perform it for about 10 repetitions for 2 to 3 sets, several times a day. Next, we're going to work on external rotation strengthening. So that's going to strengthen those other 2 rotator cuff muscles on the back side of the shoulder, just below that supraspinatus. You're going to take an exercise band. Initially take one that's really light, that you can really control and feel the contraction. And put my elbows by my side like this. I'm going to grab it so that my palms are facing upwards, and I'm going to pull it apart. Just really pulling that apart, and then come back to the midline here. Pull apart again, really squeezing the muscles on the back side of your shoulder, and also those muscles that are close to your spinal cord or your vertebrae. Those kind of what's called rhomboid major and minor muscles. Those are between the shoulder blade and your spine. Almost like you're trying to pinch your spine together. When you go back, really squeeze that. Perform 2 to 3 sets of that for 10 to 12 repetitions. So we're going to take the same band, we're going to work on internal rotation. So a lot of times in my videos I do have those bands that fasten to the wall or around a door handle. So if you don't have that, you just have just one piece of band. What you can do is, we're going to say again, it's my right shoulder that's affected. You're going to take the band, wrap it around my leg. You can tie this, you can go however you want to go. So I'm not going to tie it for the purpose of the video. I'm going to step out to the side, bring my elbow into my side, and then I'm going to pull it in like this and work on that internal rotation. That's going to work a muscle called the subscapularis muscle. It's on the front side. It's the biggest of all 4 rotator cuff muscles. So what we're essentially trying to do is strengthen all the muscles in the area. Everything on the front, everything on the back, because remember that one across the top in the middle, that's the one we're talking about that's irritated and painful. So we need to strengthen everything else to kind of take over the job and to help stabilize for that muscle. Again, taking that same band, we're going to work on retraction or pulling back. So what you're going to do is find a stable surface, wrap that band around that. Again, if you have one of these that fastens to the door, one of those, a hook or a loop, that's fine. And what you're going to do is pull this back, almost like you're trying to, crank maybe a lawnmower or a weed eater or something like that. Pull that back, squeeze the shoulder blade back as it comes around on your spine, keeping the elbow nice and tight. It's okay to have maybe some popping or grinding, or again, to increase pain in the area. That's normal. You're going to repeat this for 2 to 3 sets, around 10 to 12 repetitions. This exercise is going to be scaption, or you can call it abduction or flexion or whatever. I don't normally like to go right in the front or right out to the side. I kind of go out in the middle, kind of halfway between those 2 points. That's really more of the normal plane of your shoulder blade as it sits on the ribs. It's also known as a scapular plane. Some people call it scaption. So what I'm going to do with this is I'm going to take my unaffected side here and hold the band down. And I'm going to use my other hand, my affected hand, and shoulder here, and bring it up to about shoulder level. You can go higher than that, but initially just working towards coming up to shoulder level and then back down. Some people, early in my career, I've seen a lot of therapists do this with a thumb down. They'll kind of rotate down in that empty can position. So that same position that you perform the empty can test. I don't personally like that. I'd rather go more thumb up position with this. I think that does better for the patient. It's definitely more comfortable, not as painful. You're going to perform that for 2 to 3 sets of around 10 to 12 repetitions. Now here's a question that a lot of people ask. They'll say, what if you can't pull the band apart, if you can't pull it in, and definitely if you can't bring it out to the side? Should you still perform the exercise? Yes, in most cases you can still perform the exercise. We're just going to turn it into more of an isometric, where there's a muscle contraction, but there's no movement. So if you're going to go into that external rotation position where we're pulling the band apart, maybe the unaffected side I can pull it out, but the affected side I just really can't pull it. That's okay. Just still work on contracting the muscle So I'm contracting the back of my shoulder, trying to pull the band apart. It's not moving, but that's okay. So instead of repetitions of maybe 10 or 12, I'm only going to perform 3 to 5 repetitions, but I'm going to hold this for around 5 to 10 seconds if I can. I'm going to really try to hold that static and then relax. Pull that as far as I can again, hold that and relax. You repeat it the same way for that internal rotation, so pulling it in towards your abdomen, you're going to do the same way. So even if you can't pull it in, if it's just a little bit, just statically hold that for the same way, holding that and relaxing. And then again, also bringing that out to the side here in that scapular plane. Maybe that's all I can do is just keep it right here. So I'm going to hold it right there statically, do the best I can and relax, pull it back up again, hold that right there, and then relax. You still want to go through your range of motion using that cane or that tabletop slide, so we don't end up with some stiffness that on goes and the shoulder. You can't really get it stuck. Basically, we want to create a frozen shoulder situation or an adhesive capsulitis situation, something like that. So we want to make sure that you keep the range of motion going. So definitely keep doing those cane or broom handle movements as well as those tabletop slides all the way through your strengthening program. Now there are other more advanced exercises that you can get into, things like prone Ys, prone Ts, using dumbbells, free weights machines, all those kinds of things. But this is just to initially see if you have that supraspinatus inflamed, something going on with it, maybe it's torn. And if so, then what are some things you can do at home just to do basic return of movement and try to help with your pain. Now, as always, if you think you have a medical condition, you want to make sure and have that checked out by a medical professional. And if that first test, that drop arm test, where you try to bring the arm up and hold it, and you cannot hold it, then you definitely want to seek medical care if you're unable to complete that test. In other words, if the test is positive. Thanks so much for watching this video. I hope that it helps with your supraspinatus or rotator cuff pain and irritation. Be sure and hit that subscribe button so you can stay up to date on all my content.